Good evening, I'm Nima and this is Forum Daily for Monday, March 27th. And tonight we begin with the funeral of two Edmonton police officers killed in the line of duty. Edmonton Police Constables Brett Ryan and Travis Jordan were remembered today at a regimental funeral, which was held just 10 days after their deaths while on duty. The pair were responding to a family dispute at an apartment complex on March 16th. Now, this was when they were gunned down by a 16-year-old boy. The families of the officers issued statements yesterday thanking the public for their support as well as for respecting their privacy. Staying in Alberta, where fire officials say at least 10 people have been injured after an explosion destroyed a home in Calgary. They say the force of the explosion created a large debris field, several fires, and damage to surrounding houses in a northeastern neighborhood. Officials say the 10 injured were believed to have been inside the home when it blew up. Crews have been unable to search the site and look for other victims due to structural problems. The cause of the blast is still unknown. Meanwhile, police say a 16-year-old boy stabbed to death by a stranger at a Toronto subway station was sitting on a bench when he was attacked on Saturday evening. Gabriel Magalhaes was rushed to hospital where he later died. A 22-year-old man has been arrested and charged with first-degree murder in the latest in a string of violent incidents on public transit in Toronto. Well, turning to some concerning numbers for equal access in Canada. Federal Auditor General Karen Hogan says about 60% of people with disabilities encountered barriers on federally regulated planes and trains in 2019 and 2020. And while she found Via Rail and the Canadian Air Transport Security Authority have made accessibility improvements over the last several years, she is flagging some serious gaps. Ms. Hogan discovered that both deal with accessibility complaints on a one-off basis. This rather than using them to take a broader look at the accessibility of their services. She says this leads to missed opportunities to gain insights on the travel experiences of persons with disabilities. The Canadian Armed Forces is facing anger and pushback from troops about its plan to cut off a cost of living allowance program with little to no notice. The military announced last week that it would be cutting off roughly 7,700 armed forces members from a financial aid program starting in July. Experts say the lack of notice speaks to larger problems around how the military treats its people. They say they worry it's sparking anger and frustration, all at a time when the Canadian Armed Forces is struggling with a recruitment and retention crisis. Opening hours are being extended at 39 border crossings with the United States and at several airports across the country. The shift comes as the Canada Border Services Agency returns to pre-pandemic hours. The changes will take effect on March 31st. The border agency first restricted hours at land border crossings in April 2020. It closed many points of entry early and stopped 24-hour service at 7 crossings. The news comes days after U.S. President Joe Biden's visit to Ottawa for meetings with Prime Minister Justin Trudeau on cross-border issues. Meanwhile, the federal government is expanding its sanctions against Iran. This by adding 8 Iranians, a company that makes armored vehicles, and a cybersecurity training institute to its list. The move comes after officials were heavily criticized at a weekend rally in Toronto for not listing the entire Islamic Revolutionary Guard Corps as a terrorist organization. Prime Minister Justin Trudeau has argued that this would punish Canadians who were drafted into Iran's military by force. Well, as the cost of groceries remain high, agriculture experts are now warning that lettuce prices will likely rise next month and could stay high into the summer. Now, this is because of flooding caused by extreme weather conditions in California's Salinas Valley. Tens of thousands of hectares of fields have flooded since the beginning of the year, delaying planting and causing hundreds of thousands of dollars in crop damage. This year's Green Shirt Day logo was designed by a 2-time Organ recipient from Saskatchewan. Green Shirt Day is held every April 7th. It was created 5 years ago after the death of Logan Boulay. He was one of the 16 people who died in the Humboldt Broncos bus crash of April 2018. Brandy Henn, who is 39 and lives in Regina, says her design was inspired by the Pittsburgh Penguins logo and team captain Sidney Crosby. Mr. Boulay had admired the Canadian athlete since he was a boy. Mr. Boulay was 21 when he signed up to be an organ donor 5 weeks before the crash. He prompted many others to do the same when they heard about his decision. Stay with us. Forum Daily will be right back after the break. And when we return, we're going to be taking a deeper look at surgery backlogs across Canada. We're going to be speaking with Tracy Johnson from the Canadian Institute for Health Information up next. So stay tuned. Forum Daily will be right back after a short break. Stay with us. A recent report from the Canadian Institute for Health Information has some disappointing results on Canada's surgery backlogs. The study says that despite hospitals across Canada performing surgeries at close to pre-pandemic levels, it's not enough to overcome the backlog. The report says many patients are waiting 1 to 12 days longer for cancer surgeries, which the Canadian Cancer Society's Andrea Seal says is too long. And only about half of Canadians are reportedly getting knee and hip replacements within the recommended 6 months. The Institute's Tracy Johnson says staffing shortages are complicating efforts to reduce the backlog. Well, joining us to discuss the matter is Ms. Tracy Johnson herself. Ma'am, welcome to Forum Daily.
Thank you for having me.
So for some further perspective, can you tell us a little bit more about the overall state of the surgery backlog across Canada and whether some provinces are more affected than others?
So we at CI receive all the hospitalization data from across Canada. So what we can look at is what happened during the 30 months of the pandemic. So how many surgeries were performed compared to pre-pandemic. And from that look, we estimate that about 937,000 fewer surgeries were done across the country.
And what were found to be the most commonly delayed surgeries?
So the most commonly delayed surgeries are surgeries that we call scheduled surgeries. They are less urgent and less life-threatening. It doesn't mean it's not uncomfortable for patients, but an example of that would be surgeries like hip and knee replacements and cataracts.
So, how are these surgery delays potentially impacting the overall recovery chances and the health of the patients themselves? You mentioned hip and knee surgeries, but also what about delays for cancer treatment as well?
So we can see that cancer treatment like cardiac surgeries were the last to be stopped and the first to be begun during especially those at that initial stage of the pandemic when for public health reasons we had to shut down hospitals and keep folks apart. Those were the ones that were prioritized to the top. What we can see is that about 20% fewer were done. And right now, we see that there is, with some of the common surgeries like breast cancer and gut surgery, GI surgery, we can see that some of the wait times are 1 to 2 days longer. We don't have benchmarks for these, but it's reflective of the fact that the system overall is struggling to keep up. More concerning, probably, with cancer surgeries was the delay in diagnostics for a number of people, especially at the beginning of the pandemic. So, regular scans for cancer were stopped as well.
And on that note, can you tell us a little bit more about these delays to screenings for potentially life threatening cancers? Now, that was an ongoing pandemic concern, but how much of a delay are people experiencing when it comes to screenings amid all of this?
Well, screenings are right back to approximately, especially for about half of people who go for either a CT or an MRI scan. The wait times for those right now are somewhere in the range of, for MRIs, it's about 42 days, and it's about 2 weeks for CT scans. And that's about the same as it was prior to the pandemic. 2020 was the worst year for numbers of scans done. At the moment, most provinces are up doing as many, if not more, scans than they were before. So they're rapidly catching up on that. Some people are waiting longer, though, at that 90%, 10% of people were waiting a couple of weeks longer than they used to wait prior to the pandemic. So again, probably a backlog in some of those delays.
And we mentioned that you were talking a little bit about staffing being an issue. So, can you tell us a little bit more about the healthcare staffing crisis and how that's impacting this backlog in surgeries and screenings?
So in Canada, just like around the world, we have an aging health workforce, but we have an aging workforce all around, but health in particular has been aging. And after a very tough couple of years with COVID and people working flat out, there's been earlier exits from healthcare and from those professions, as well as the number of anticipated retirements that people were going to have. So it's put us in a particularly tough spot with health.
Tough spot indeed. Just a quick 45 seconds left here, but what is your organization suggesting to be done to address this backlog and the shortage of staff?
What we usually try and do is put the data out there so that provinces can look at it and try and improve from each other. I would say right now that the focus the federal government and the provinces have through the recent bilateral agreements on more funding for surgeries is a step in the right direction. There are also lots of new funding for health human resources, and there's lots of strategies being looked at across the country to try and increase the staff that we have in healthcare.
Right, lots to keep our eyes on, lots of developments. So thank you again for joining us today, Ms. Johnson. We hope to have you back on Forum Daily in the near future. Thank you again.
Thank you for having me.
Stay with us. We'll be right back. And after the break, we're going to take a look at the effects of media and advertising on children's health. We'll be joined by Dr. Leia Minaker to discuss the harmful impacts of marketing efforts on your kids. Up next. Concerns around the impact of external influences on children and their overall mental and physical health seem to be rising amid more research pointing to the connection between them. A recent study funded by the Heart and Stroke Foundation finds that children are being bombarded with messages in grocery stores and restaurants that make junk food look more appealing. Meanwhile, a Vancouver woman has filed paperwork in BC Supreme Court against video game maker Epic Games. Now, she alleges it designed its popular game Fortnite to be as addictive as possible for children. Some argue that children and youth are especially vulnerable to such influences because they may not have the cognitive maturity to differentiate between marketing and entertainment. But in a more digitally connected world, how can parents protect their children from the potential harms of marketing tactics? Well, joining us now to help us with this is Dr. Leia Minaker, a public health expert and associate professor for the School of Planning at the University of Waterloo. Dr. Minaker, welcome to Forum Daily.
Thanks for having me.
So, marketing can be seen nearly everywhere we look, but how does the marketing on children differ in terms of its overall impact on mental and physical health?
That's a great question. I think it's one really important to consider, especially when we think about our role as parents, as educators, as anyone in society when we think about protecting kids. So, the biggest difference when we think about marketing to kids versus marketing to adults is that kids under 5 typically cannot tell you the difference between when they're watching a commercial and when they're watching a program. They don't understand what is happening in terms of someone trying to sell them something. Kids about 8 and under can sometimes tell the difference, but they still don't understand the intent behind the marketing and they tend to just believe whatever they're told. And by around 10 to 12, kids usually start to understand the difference between, for example, marketing and someone telling them the truth about everything, but they're not always able to be critical about the methods or what the actual intention is.
Very interesting information there. Now, in terms of this recent study funded by the Heart and Stroke Foundation, what do we know so far about the marketing of junk food in particular and how it could entice children and ultimately lead to sales?
What we did in our study is we looked at over 2,000 restaurants, about 800 stores, and we took about almost 7,000 photos from all of those stores and restaurants across 11 regions in Canada, including Canada's north and urban and rural areas. And what we found was that there was a high level of marketing of unhealthy foods and beverages to kids. And so what we did, for example, we looked in stores at the number of island displays that might have, cartoon characters on them or child themes, which we consider to be like magic or zoo animals or rainbow colors, bright colors. We looked at checkout aisles and looked at the kind of variety of different kinds of sugary or salty snacks available there. We also looked at interior and exterior marketing, for example, in restaurants, at kids' meals. So, for example, how many, restaurants give kids meal or toys or other child-oriented giveaways just for purchasing a meal. So we did a sort of a large study, the largest of its kind in Canada, to do a baseline assessment of what's happening in terms of marketing at the point of sale to children. And we found that there was a very high prevalence of marketing to kids.
And how do you see the marketing of junk food and other products impacting a child's potential dependency on unhealthy foods into adulthood? I'm talking about maybe sugar addiction, setting up unhealthy habits, or maybe even obesity in the near future.
Yeah, we know that marketing to kids is bad for their health in terms of increased consumption of those types of foods that are being marketed. And in our study and lots of other research that's been done in different types of settings shows that, that predominantly, like the vast majority of ads are for unhealthy foods, not for healthy foods, which is not really surprising. That said, those are the kinds of foods that kids are going to be consuming more of as a result of the marketing, which does have long-term implications for their health. And dietary risks is one of the three biggest determinants of death and disease in Canada. It's one of the leading causes of global morbidity and mortality. And so I think anything we can do to try to improve Canadians' diets, and especially kids' diets, the better for long-term health. In terms of addictions, there's, I think, some debate around that still in terms of whether or not marketing leads to, addictive like eating. But I think that in general, it's important for all of us to be eating as healthy as we can and not to have multi-million or multi-billion dollar businesses undermining our efforts to eat healthy.
All right, Dr. Minaker, a quick 30 seconds left here, but if you could leave us with one piece of advice, especially parents in terms of protecting their kids from such marketing harms, what would it be?
I mean, of course, it's parents' jobs to say no when their kids pester them for something at the grocery store or restaurants. That said, it would be great to have some regulations in place that would help parents do the job of keeping their kids healthy by making it easier for them to say yes to healthy foods to their kids.
After 2 days of mass protests, Israel's Prime Minister Benjamin Netanyahu announced a delay in his controversial plan to overhaul the judiciary. He said on Monday that he wanted to give time to seek a compromise over the contentious reform package with his political opponents. Earlier today, tens of thousands of people hit the streets of cities around the country. Meanwhile, Israel's National Labor Union called off a nationwide strike after Mr. Netanyahu announced he was pausing his judicial overhaul. Unrest continues in France, where the Louvre Museum in Paris has been closed to the public. Workers at the museum are joining the wave of strikes against President Emmanuel Macron's unpopular pension reform plans. Dozens of employees blocked the entrance. They were demanding the repeal of the new law that raises the retirement age from 62 to 64. Another nationwide protest is planned for tomorrow. Following major turmoil in the banking sector, North Carolina-based First Citizens will now buy Silicon Valley Bank. The California-based tech industry-focused financial institution collapsed earlier this month. The deal could reassure investors at a time of shaken confidence in the banking industry. The U.S. Federal Deposit Insurance Corporation and other regulators had already taken on extraordinary steps to head off a wider banking crisis. This by guaranteeing depositors at SVB and another failed U.S. bank that they would have access to all of their money. Moving to Africa now, where thousands of anti-government protesters marched on the streets of Kenya's capital on Monday. They gathered in Nairobi despite the government and police declaring that the protests are illegal. But opposition leader Raila Odinga says Kenyans have a right to demonstrate. The opposition is protesting against the rising cost of living, and he's calling for President William Ruto's resignation, saying he wasn't validly elected in the last election. More political turmoil in India, where members of opposition parties dressed in black disrupted parliament and protested in the capital. This comes after Rahul Gandhi, a key opposition leader and fierce critic of Prime Minister Narendra Modi, was expelled from the legislature last week. Mr. Gandhi's expulsion on Friday came a day after a local court convicted him of defamation. It sentenced him to 2 years in prison for mocking Mr. Modi's surname in an election speech in 2019. Over in the United Kingdom, members of the governing Scottish National Party have chosen 37-year-old Health Minister Humza Yousaf as their new leader. He replaces First Minister Nicola Sturgeon. She unexpectedly stepped down last month. Health Minister Yousaf is the son of South Asian immigrants, making him the first person of color to serve as Scotland's First Minister. Tensions continue to rise in the Korean Peninsula. This comes as a nuclear-powered U.S. aircraft carrier and its battle group began exercises with South Korean warships. Hours earlier, North Korea fired TWI short-range ballistic missiles in an apparent protest of the Allies' expanding drills. The seventh missile test this month underscored heightened tensions in the region. Both the North's weapons tests and the American-South Korean joint military exercises have intensified the cycle. South of our border, some of the most impoverished areas of the U.S. are getting aid. This comes after a massive and fatal tornado ripped through the region, removing entire towns from the map. The hour-long path of destruction saw parts of Mississippi reduced to rubble, killing at least 21 people in the state and injuring dozens of others. Search and recovery crews resumed the daunting task of digging through flattened and battered homes, commercial buildings, and municipal offices after hundreds of people were displaced. The debate over daylight saving time is over, at least in Greenland. The residents have switched to daylight saving time and moved their clocks 1 hour forward for the very last time. Unlike most of Europe, Greenlanders will leave their clocks untouched come autumn when daylight saving time ends. Now, this means that Greenland will be 3 hours behind many other European countries instead of 4. Locals say it will benefit Greenland by giving the country another hour in the day to do business with Europe. It is an exciting week for stargazers. 5 planets are set to line up near the moon this week, and the best day to catch a glimpse of Mercury, Jupiter, Venus, Uranus, and Mars will be tomorrow. NASA astronomer Bill Cook says you should look to the western horizon right after sunset, but the window of opportunity will only last for about 30 minutes. The planets will stretch from the horizon line to around halfway up the night sky. All right, I'm Nima Rajan, and that'll do it for your look at national and international news for today. Remember, for more news on demand, you could always visit our website, thenewsforum.ca, and make sure to follow us on social media. We're available on Facebook, TikTok, Instagram, and Twitter. You can also watch all of our commentary programming on the News Forum YouTube channel. All right, thanks again for joining us today on Forum Daily News, and we'll see you next time. Take care, Canada.